Hi, I'm Craig Stout with Professor Medicare. What if you're over 65 and on an employer plan? More and more of us who are over 65 are still working. Let's look at where you fit in the Medicare universe. If you have medical insurance coverage under a group health plan based on your spouse's or your current employment, you may not need to apply for Medicare Part B at age 65. But there are two qualifications for this. First, your company must have more than 20 employees, and that is the total employees working for the company. Second, the company health plan must be creditable, which means it must be at least as good as Medicare coverage. If in doubt, contact your benefits administrator. If you satisfy those two requirements, then you'll qualify for a special enrollment period that will let you sign up for Part B during any month you remain covered under the group health plan or you and your spouse's employment continues. The 8-month period that begins with the month after your group health plan coverage or employment that it's based on ends, whichever comes first. You have 8 months to sign up for Part B without a penalty, whether or not you choose COBRA. Later in the video, I will walk through the actual enrollment process. But what about Part A? If you or your spouse have worked for 10 years or 40 quarters and paid into Medicare taxes, you'll have zero premium for Part A. You can enroll in A during your initial enrollment or any time later. Since A will be secondary to your company plan, it's likely you won't use it, but you will be assigned your Medicare claim number along with your card. If you have an HSA, health savings account, unless you want to deal with an IRS fine or penalty, don't contribute to the HSA when starting Part A or B. If you're over 65, stop contributing 6 months before Medicare starts. That leaves B. The reason you don't want to enroll in B if you have a creditable company plan is the premium for B. Why pay that premium if you won't use it? The company plan is primary and Medicare secondary with this scenario. When we meet with people still working and over 65, here's our process. Even though you're not planning retirement in the immediate future, Medicare may be a better option than what you have. If you're over 65, you can leave the company plan and enroll in Medicare using a special enrollment period at any time during the year. But first, we need to look at the company plan and compare it with Medicare to see which is best for your circumstances and finances. Here are the key items to compare: the premium cost, deductibles, cost after deductibles, providers, the network, the MOOP or the max out of pocket, and then the total benefits to include dental, vision, hearing, and fitness. Sometimes the company plan is excellent with low premiums and low deductibles, and other times Medicare may be much less with better benefits. But we simply need to do a line-by-line comparison to illustrate the differences. Only then can you make an informed decision. What about your family members' health coverage? If you have a younger spouse and children under your company plan, what happens to their coverage and costs if you go on to Medicare? That's another consideration. We often meet with clients who are in the planning stage. They're planning to retire in a year or two and want to look at options. I recommend that kind of forward thinking. Let's eliminate surprises by planning your healthcare coverage during your retirement. Here's a scenario once you've decided to retire and move off an employer plan. It's best to start this process 6 to 8 weeks before ending your company plan. For this example, let's use a 67-year-old who already has Part A. He will leave the employer plan on March 31st and wants his Medicare coverage to start on April 1st. We meet on February 1st. Applying for Part B is a 2-step process. Step 1. Take Form OMB number 938787 to your HR department and have them complete the form. They insert your start date for the company plan and your ending date for that same coverage. We have the forms at ProfessorMedicare.com. You'll also need this form for your application to Social Security, OMB 9381230. Now that you have the form OMB 938-787 completed and have filled out the 938-1230, you need to apply for Part B with Social Security. Call 800-772-1213 and tell Social Security what you want to do. They may make an appointment for you, or they may advise you to go online and apply. Prior to the pandemic, we advised clients to show up at a Social Security office, but lately people have been turned away without an appointment date. It's best to call first. After you've applied for Part B, it normally takes about 2 or 3 weeks to get your approval. When you receive your letter of approval or have gone online to your Social Security account to find your approval, call Professor Medicare. Then we can enroll you in a plan. But what about Part D? We covered Parts A and B, but there's also Part D. Just as you needed to provide proof of creditable coverage for Part B, you need to do the same for Part D drug coverage. When you contact your HR department to have them fill out the OMB form for Part B, ask them for a cover letter on company letterhead stating your start and end dates for your creditable drug coverage under that same plan. Keep the letter and then provide it to your future Part D carrier. The carrier will want that letter to avoid assessing you a fine for Part D late enrollment. Now let's recap the steps to enrolling in Medicare if you're over 65, still working, and have a creditable company coverage. If you're planning to continue working, compare Medicare coverage with your company plan. Determine if you want to continue the company plan or go on to Medicare. 2. Establish your timeline. When you want the employer plan to end and when you want to start Medicare. Once you decide to enroll in Part B, take this form, the 938-787, to HR and have them complete it with your start and projected end dates for the company plan. Also, get a letter stating you had creditable drug coverage for those same dates. Number 4, complete form OMB 938-1230. 5, call Social Security at 800-772-1213. Tell them you want to apply for Part B. They will advise you on your next steps. Once you receive your Part B approval with an enrollment date, call us, and then we can find the best coverage for your needs. We have the forms on our website, ProfessorMedicare.com. If you like the video, please subscribe. Check out our Professor Medicare channel on YouTube. Also, feel free to call with questions. Here's our contact information. Bye for now.